ये जोड़े जो ये तो जाएगा मुझे
પેલા વજીર એક્સમાં પેલો પેલા સીબુ લેવડાયા છે ને બધા
relative strength. But disruptions caused by the pandemic forced people to examine, explore, adopt and adapt new ways of working. It is expected that pharma industry will continue to reimagine itself while driving growth and boosting value. I request all the dignitaries, Dr. H.G. Koshia sir, Dr. Milind Joshi sir, Dr. Dara Patel sir and Dr. Mayank Dubey sir to come upon the dais and take their chairs. Please sir. It's my pleasure to introduce Dr. H.G. Koshia sir, Commissioner, Food and Drugs Control Administration, Gandhinagar. I request Mr. Jyotindra Bhatt to welcome sir with a bunch of flowers and memento. Sir is actively representing 9 national and state level committees. He is the chairman of Committee Track and Trace for preparation of guidelines to prevent the menace of spurious drugs. He has played a pivotal role in the transformation of pharma sector in Gujarat to emerge as a favorable investment destination with proactive and pragmatic approaches. Dr. Koshia is a recipient of the Best Drug Controller Award by All India Drugs Controller Officers Confederation. He is also a member of Council of Expert at US Pharmacopoeia for the year 2015 to 20. Thank you so much, sir, for accepting our request. Also, we have with us Dr. Milind Joshi, Consultant Mumbai, as our keynote speaker. I request Mr. Hasmukh Vyas to welcome sir with flowers and present memento. Sir is President at Global Regulatory Management for JB Chemicals and Pharmaceuticals Limited. he has accompanied Shri Ramnath Kovind, Honorable President of India, to Switzerland for the business delegation meeting held in the month of September 2019. He is the chairman of the United States Pharmacopoeia South Asia Stakeholder Forum and was the member of nominating committee of USP. He is the member of several professional organizations including IDMA, where he was the chairman of Quality and Technical Committee, member of National Executive Committee and Regulatory Affairs Committee, CII National Committee on Pharmaceuticals. Thank you so much, sir. We have Dr. Dara Patel, Secretary General, Indian Drugs Manufacturers Association, Mumbai, as our guest of honor. I request Mr. Jayesh Joshi, sir, to welcome sir with a bunch of flowers and present memento. Sir is bestowed with many prestigious awards like Pharma Professional of the Decade by Pharma Leaders Group in 2014, Pharma Ratna Lifetime Award for invaluable contribution towards the Indian pharma and healthcare industry in 2019, 101 Most Fabulous Global Healthcare Leaders Award conferred by ET Now in 2020, and many more. He has total 44 years of rich experience in procurement, contracting, administration, and public relations, along with 20 years of experience in leading pharmaceutical association IDMA and 26 years of experience working with multinational companies as well as large business houses. He has collaboration with many national and international associations. He has attended and led many international delegations and conventions. Thank you so much, sir. Also, Dr. Mayank Dubey is present with us today. I request Mr. Anas Sheikh to welcome sir with a bouquet and memento. Sir has done his PhD in management and carries 16 years of experience in pharmaceutical and clinical research industries, which includes 10 years in business operations and commercial domain and 6 years in analytical domain. Currently, he is senior manager with LabCorp Drug Development, leading a cross-regional team based at Asia Pacific and actively involved in expanding reach of LabCorp in APAC. Sir also has experience of handling large and complex outsourcing deals and possess skills like leadership, team management, pricing and commercial, key account management, process improvement and transformation, change management, hiring and retention. Thank you so much, sir. Now I request Dr. Mayank Dubey to deliver a welcome address.
Hello, am I audible? Okay. Good morning, Suprabhat, and welcome to the 7th National Conference on the Pharma with the theme of Indian Pharma Sector Post-COVID Emergence on the Global Landscape. Dr. H.G. Koshia sir, Dr. Dara Patel sir, Dr. Milind Joshi sir, our distinguished and learned speakers, our valued sponsors, our supporting institutions and invited guests and friends. It is our proud privilege to welcome you all to the 7th consecutive event on the Pharma Confex 2022, organized to discuss and address the important issue focused on the pharmaceutical industries. First of all, it is my honor to welcome all the 3 dignitaries to this dais. As ma'am has already introduced about all the 3 dignitaries, I would like to speak a few more words about them. So we are grateful to Dr. H.G. Koshia sir, Commissioner, Food and Drug Control Administration, Gandhinagar. He is the recipient of the Best Drug Controller Award by All India Drug Controller Officers Confederations, and he has contributed immensely to the pharma sector. We welcome you, sir, and we feel obliged to have your guidance and support over here. We also welcome and thankful to all the officers that is there for their support. Thank you, sirs. Next, I would like to introduce Dr. Milind Joshi, sir, who is the President of Global Regulatory Management, JB Chemicals and Pharmaceutical Industries. Very few individuals get a chance to accompany Prime Minister of India, and Milind Joshi sir is one among them. He has accompanied Honorable Prime Minister of India to Switzerland, Shri Ramnath Kovind sir, for the business delegation meeting held in the month of September 2019. Thank you very much, sir. It is our privilege and honor to welcome you on this day. Today, we also have a guest of honor, Dr. Dara Patel sir, Secretary General, Indian Drug Manufacturing Association, Mumbai. He is bestowed with many prestigious awards like Pharma Professional of Decade by the Pharma Leader Group in 2014, Pharma Ratna Lifetime Award for the invaluable contribution towards the Indian pharma company and healthcare industry in 2019, and 101 Most Fabulous Global Healthcare Leader Award conferred by ET Now in 2020, and many more. He is known for his intelligence, and he is a leading speaker not only at the national but as well as international conferences. Thank you very much, sir, for kindly agreeing to be here today and share your valuable knowledge and vision. We are also grateful to our speakers to spare their valuable time and acknowledge with us. Thank you to our sponsors, Cadila Pharmaceutical and Torrent Pharmaceuticals. And last but not least, we are also thankful to the audience who is here to make this event fruitful. Okay, friends, here I would like to quote some statistics. So, India has more than 3,000 pharmaceutical industries, which has more than 10,500 pharmaceutical manufacturing facilities. The domestic pharma market has a turnover in India reaches to 20 billion US dollar by the end of 2019, that is pre-COVID. And it is estimated that this figure will reach to more than 100 billion US dollar by the end of 2025. There are more than 195 countries in the world, and out of which only 15 countries or less than 15 countries were able to manufacture and develop their own COVID vaccine. And we can proudly say that India is one among them. India has not only developed the vaccine for its own, but India has also shared or developed or transferred this vaccine to 95 other countries. And as per the data, the estimated number of doses that India has exported to 95 countries is 723 lakhs, which is a huge number. This itself proves that this pharmaceutical industry is witnessing a healthy foreign direct investment, amalgamation, and collaboration. The pandemic has both spurred and cultured the growth of the industry in different instances. The coming decade is expected to bring a new height for the pharmaceutical sector. Backed by the strong intellectual property and regulatory framework, the Indian pharmaceutical industry seems to poised the edge of success. With this background, the theme of today's conference is proposed as Indian pharma sector post-COVID emergence on the global landscape. More than 10 industry experts will share their knowledge, experience, and vision with the delegates during today. We welcome all the dignitaries and delegates and invite you to the benefit from this unique opportunity. Thank you very much.
Thank you so much, sir. Now it's time to inaugurate this event with an auspicious lamp lighting ceremony. I request all the dignitaries on the dais to join for the same. Shubham Karoti Kalyanam. शुभम करोति कल्याणम आरोग्यम धन संपदः शत्रु बुद्धि विनाशाय दीप ज्योति नमोस्तुते। दीप ज्योति ही परब्रह्म दीप ज्योति जनार्दनः दीपो हरतु मे पापम Sandhyadeep Namostute. Thank you so much, sir. Ladies and gentlemen, now let us have the privilege of listening to Dr. Dara Patel. May I request sir to address us all?
So good morning all of you and the organizers, Saket, respected Hemant Koshiaji, Milind Joshi, Mayank Dubey, seniors from the pharma industry, delegates and students who are here. It's indeed a pleasure to be amongst all of you. I think I'm coming here after almost 4 years now. At one time we used to meet practically every year, and that is what the pandemic has done to all of us. But fortunately, people like Mayank Dubey still work from home. See, that's why he looks so nice and fresh. And we all go to office and we have started working 24 hours now. So on behalf of our National President, Dr. Viranchi Shah, and the entire membership of IDMA, it gives me great pleasure to welcome all of you to this wonderful program put up by Saket. The current pandemic has brought the entire world to its knees, and the whole world has observed the adverse catastrophe of this global pandemic. And I think no country, no city has been spared by this pandemic. The pharmaceutical industry has moved quickly into the crisis mindset, managing people's problems and protecting the business and trying to be part of the solution. The theme of today's conference is very apt, very suitably put up. Indian pharma sector post-COVID emergence on the global landscape. And India did emerge as a winner in this entire pandemic. For too long, you'll agree that the pharma industry has been labeled as slow to respond to the environmental changes. The COVID-19 pandemic has come with an almost equal share of woes and opportunities for the industry. On a positive note, the industry has taken advantage of the pandemic, and we have demonstrated our skills to change adversities into opportunities. Digitalization has played a very key role in this. I'm sure all of you will agree to it. India has played a humongous role during the 2-year long-running COVID-19 pandemic. And we supplied medicines made in India and vaccines to practically every nook and corner of the world who has asked for it. Just a small example, we supplied vaccines to 98 countries. We supplied medicines like hydroxyquinoline, remdesivir, favipiravir, antiviral medicines like famciclovir, tocilizumab, itolizumab, doxycycline, ivermectin, etc. to practically almost 50 countries. We would have supplied remdesivir to a larger number of countries, but we were requested by the government that first you meet the requirement of our people, and that's why the offtake was a little slow. Then imagine sanitizers. I was in Chennai the other day for a conference of our IDMA, and you'll be surprised that majority of the manufacturers have done very well in manufacturing, supplying sanitizers. So Indians are first to take advantage of any adversity, and we change it into opportunity. That's a big quality in us. PPE kits were manufactured by us. Hand gloves were manufactured. Oxygen in bulk containers were manufactured and supplied to hospitals. And another laudable initiative was repurposing of the drugs for use against COVID. During 2020, the new normal had taught us to change from work from office to not only work from home, but work from anywhere. I mean, some people took the advantage going for a vacation, but they had their laptop with them and they worked. So this is again another quality of we Indians. Digital, as I told you, is an idea whose time has come, friends, and we need to catch up. Let's not lag behind it. Despite these trying times, the pharmaceutical industry has triumphed, and now we have learned to live with the new normal that we all have experienced during the COVID-19 pandemic. Most of the healthcare and pharma companies have learned to adapt to this new normal. The companies who have not adapted to the new normal, digitalization will have to catch up with the rest of the pharma companies, or they have to lag behind. Earlier, you all knew that to do well, there is only one simple statement made by people: either you perform or you perish. Today, it is either you digitize or your business and profits diminish. So we need to digitize. The pharma industry business is normal and is progressing very well. There is an increase in demand of medicines, and the future may not see patients having to go to doctors and hospitals every time they fall ill. The doctor's medicine and his magical tools will be going to the patients through electronic devices. At an industry level, the changes will likely be more sweeping and more focused on network optimization, patient centricity, and new demands on capacity and efficiency. Let's talk for a while on the pandemic that we faced for 2 years and how we managed to increase the production capacity. As you're all aware, the Prime Minister had a meeting with all the industry captains. We were all there at Mantralaya, and some were there in Gujarat and some in Hyderabad. And he addressed us. This was on the 21st of March 2020. And he said that, are you all geared up? We said, yes, sir, we are geared up. But he said, I want to promise from you that first you will supply medicines required to our own kith and kin here. And then you start exporting. And we all promised him to do that. All the industry captains agreed. And imagine, next day onwards, there was a lockdown. At least I have experience in Bombay, nobody was able to move out. Neither the man working in the pharma industry or any allied industry, nor anybody who's a pharmacist, who's having a pharmacy, or who's going to the hospital. Nobody. So there was such a chaotic situation, Koshia Sahib, that the production utilization in any factory was hardly 18 to 20%. So how do you expect us to supply? Then we started working with the government, with the regulatory authorities, with our police, with the Transport Association, with AIOCD, and then we started increasing the production capacity. At one time, the government allowed movement of people who were in the pharma industry. But what happens to the carton manufacturer, the bottle manufacturer, the API manufacturer? All of them need to move out and start supplying. So with great difficulty, we got all that. And then you will be surprised that within 2 months, by almost July, the production capacity increased to 80% and then to 100%. And to the credit of our manufacturers, we put up the staff somewhere nearby in hotels or in the factory itself. We arranged for their food, for their transport. We incurred all this cost without increasing any price, and we ensured that the health of our people is taken care of. And for that, we are always thankful to the pharma industry. IDMA has completed 60 glorious years. In April this 2022, we celebrated our 60th year, and Honorable Minister Mansukh Mandaviya ji and Piyush Goyal ji, both were there. We missed Koshia Sahib, of course he was not there, but his good wishes were with us. It was a wonderful program for 2 days. IDMA has a membership of 1100 members, which is not only highest in India, but anywhere in the world. And we have members in every nook and corner of our country. We have got 8 state boards. Wherever there are farmer clusters in the country, we are having membership over there. So we work very closely with the government, especially for our MSMEs, because they are the lifeline of our industry. Today, big pharma companies have a limitation. They can't manufacture everything, but they bank on load licensing, on P2P business. And that can be done by our MSMEs. So big round of applause for the MSMEs. They need the, they need the real credit. We are known as the voice of the national sector. And though we have 8 state boards, the best state board today, and I'm not just saying it because Prime Minister is from Gujarat, but it is a fact that our Gujarat state board is very vibrant, very active, a huge membership they have got. We've got more than 300 members out of the 1100. But today, Gujarat is on the world map of pharmaceutical industry because we have our Honorable Prime Minister from here. We have, for the first time, a minister who handles the Chemical and Fertilizer Ministry and the Health Ministry, which has never happened before. He is from Gujarat, and to top it up, our national president is also from Gujarat. So you can imagine the importance of Gujarat. So when I was called here, somebody asked me, "Sahib, તમે આવશો કે?" I said, "ભાઈ ગુજરાત નહીં આવ્યો તો પછી ફાર્મા ઇન્ડસ્ટ્રીમાં રહેવાય કેમ અમારી?" But it is very important that we strike a balance today in being sufficiently agile and active and to rapidly respond to fast-changing environment. In line with this, companies are setting specific goals to meet their internet and internal objectives for improved customer service, profitability and growth, focusing specially on enhanced innovation and diversity with agility and speed. Today, the pharma industry is valued at 44 billion, as the previous speaker spoke. But imagine what our target is. Can you imagine that in 2047, our target is to reach 600 billion. So imagine the power of the Indian medicines that will be at that time. And we will be growing at a CAGR of 11%. It is an opportune time for all of us, including the SMEs, to pursue a greater share in the growth story of industry. This can most likely happen when we invest ahead of time in growth, quality, risk, and compliance management. The Government of India had launched a series of policy measures in recent past, and we must thank the government for this, like Atmanirbhar Bharat, Pradhan Mantri Jan Aushadhi Pariyojana, Ayushman Bharat, and production-linked incentive schemes. More encouragement and impetus are expected in the near future through OTC policy, research-linked incentive schemes, pricing, and decriminalization reforms. IDMA congratulates and appreciates the efforts of our government, especially our Honorable Minister Mansukh Mandavia, for launching the new schemes to strengthen the Indian pharmaceutical industry. It is popularly known as SPI. These new schemes will help the industry to enhance its quality, technology, and infrastructure upgradation and capacity building, and will also encourage collaboration between various stakeholders for the overall development of the pharma industry. IDMA is committed in our Seva for Sampurna Swasthya. We want everybody to be healthy to the entire world and supply safe, efficacious, reliable, and reasonably cost medicines. We work very closely with major organizations like OPPI and IPA, and IDMA, along with these two, work very hard during the pandemic, also sharing our experiences, helping each other and supporting each other. That is what is required. Two critical uncertainties will frame how the industry will emerge post-COVID. The first one is the depth and the duration of the COVID-19 disruptions. We never know. Anything can happen anytime. We need to be prepared. The other fact is how bold the stakeholders are and their willpower and ability to align with the new world order. We need to change. That's very important because change, as you all know, is another name for progress. In a favorable bookend scenario of hope, we could see a short, sharp contravention, followed by a rapid return to normalcy. The behavior of our retail stakeholders, our pharmacists, our doctors, hospitals, our patients, all has significantly changed. As you are aware, IDMA is the national association representing the interest of manufacturers in India. So wherever there are certain new policies that are coming up, we certainly support the government, but we also ensure that the industry is supported by these. If there is no industry, there is no medicine, there is no health, there is no life. So we have always urged the government that you have to strike a balance. Whatever you do good for the patients is definitely necessary. But see that the industry also survives and it is good for the industry. Now take the example of the QR code which specified information on packaging of active pharmaceutical ingredients. IDMA has strong objections to that because there is not much difference between what is happening today in labeling and what the government wants for APIs. So we have been telling them to go slow in it. We have been telling them to see that the MSMEs are able to come up to it. Because big companies will not have a problem. They have the money, they have the manpower. It's only the MSME who will have a problem. So we always urge the government, do whatever is good for the people, but at the same time see that everybody follows suit. Don't let the MSME lag behind because they don't have the manpower, they don't have the money that the big guns have. And it is not only the QR code, it is so many other things like the new draft New Drugs, Medical Devices and Cosmetic Bill. We have gone through it. We are happy that the government has now changed after almost 50 years, Koshia Sahib? After almost 50 years. So that's a commendable thing. But some of the things which we have wanted have not come up. And we have taken up that matter with the government. For example, there have been several instances of considering a not of standard quality drug, even for minor out of specification results, as criminal offense punishable with imprisonment and fine. By invoking the clause of spurious and adulterated drugs, due to such overemphasis on penal measures, the key element of corrective and preventive action in quality management system for the purpose of quality upgradation has been overlooked. The tool of prosecution to deal with out of specification, that is not of standard quality drugs, is not used by any international regulatory agency and is dealt and through administrative and department actions only, leading to implementation of corrective and preventive action. IDMA feels that there is a need for new approach. IDMA and other industry associations have requested from time to time for this new approach, and we were expecting decriminalization of violations, especially for not of standard quality drugs and of rules under the Act. Having requested this new approach, we would like to place on record that IDMA is committed to promote quality excellence in the industry to ensure that medicines of the highest quality are made available to the patients. Not only in the local manufacture, but even for exports. Sometimes our government feels that pharma industry is doing extremely well. So you are aware that this RoDTEP, which is the refund of duties and taxes on exported products, was given to all the industries except pharma. So we have taken up that matter also. Why should we lag behind just because we are doing well? So the government is now considering, and very shortly you will get that benefit. As Charles Darwin said in his book on the origin of species, about his scientific theory of natural selection, it is not the strongest of the species that survive, nor the most intelligent, but the ones who are most responsive to change. And that is what we are, and that's why we will continue to do well. As a responsible industry association, our members are committed to adding smiles to the faces of ailing population, adding productive years to their lives, and improving the quality of their life. We do so with the lowest possible cost as compared to anywhere else in the world. You see, even the lowest of lowest developing countries, their prices of medicines are much higher than India. And still, if we continue to put the high pressure of profits and prices, the industry may not do as well as we are doing. The time has come now, friends, when we can proudly tell the world that if you ask for any medicines, we manufacture it. And the day is not far when the world will say, if it is medicines, it is India. So thank you very much. Jai Hind, Jai Gujarat, and Jai Ho to the Indian pharma industry. Thank you very much.
Thank you so much, sir, for your words. It is my honor now to invite the Honorable Dr. Milind Joshi, sir, to address us.
Namaskar, good morning. I'm carrying my mobile here just as a watch, you know. So, as Dara said, Dara, how much time you want me to speak?
I saw the bag full of papers.
Yeah. Oh, one request. Backbenchers, please come ahead. I feel so isolated. I used to act in drama, you know. I need spectators in front. You know. This is not a movie. Please come, especially all beautiful ladies. Come in the front. Come in the front, please. Don't be so shy. I'm not a very serious keynote speaker, you know that, those who have heard you. Okay. So thanks to the organizers, and please feel free. Everybody is now quite used to keep mobile phone on silent, so you can play Candy Crush, whatever, don't worry. Thanks to the organizers, I think I was here in 2016 and 18 perhaps, I'm not sure. 20 is gone, right? So, and 2022 I'm here again. So this is just Dipti, Chirag and all of you. So call me again in 2024, okay? 1960, Gujarat and Maharashtra were separated from Dvibhashik state, and till perhaps 1980-90, Maharashtra was big brother, they used to call. Of course, now the situation is changed, at least for the pharma industry, and Gujarat has become Mota Bhai, right? So, thanks to that. So, I'm sandwiched between two speakers, you know. First, Dara spoke, and after me, Dr. Koshia is going to speak. So it's a nice sandwich, but between two stalwarts. When I was young, child, I knew only one Dara, and I'm sure all of you. That was Dara Singh, right? After that, now I know only another Dara, who is equally powerful. It's not a joke to coordinate 1,100 strong industry, their MDs, owners. So Dara, well, thank you. And of course, the most powerful industry, FDA, industry controlling FDA is Gujarat now. And so Dr. Koshia is here. And I call both of them, I'm fortunate to have them as my friend, philosopher and guide. So thank you very much. So I'll speak, I'm not a professor. I never worked as a professor, but all of you must be knowing, right? Our school and college lectures are of a 45 minutes time, right? And the reason is the human brain attention span is for 45 minutes, not more than that. So then you have to get up. So I'll speak for 45 minutes, okay? Don't worry. I'm a compliance man. My career is regulatory affairs. I'll see to it that this session ends at 11 o'clock and we'll go for tea. As I said, regulatory affairs, I was introduced as a president of global regulatory management in JB Chemicals and Pharmaceuticals Limited. That was till 30th June 2022. I opted for retirement. I still continue as a consultant, but that's the past. But regulatory affairs is in my blood since 1992. So I'll speak more on that. And just a comment, I sincerely but jokingly, both I said, luckily I was married, but otherwise कोई बेटी नहीं देता था मुझे. You know, what is this regulatory affairs? क्या करता है लड़का? नहीं चाहिए. So that's why I did it. So coming back to theme now, starting with the theme. The theme is post-COVID emergence in the global landscape, Indian pharma, obviously, right? So let's do some show of hands. How many of you were COVID positive sometime? Please raise your hand. Almost everyone, right? How many of you were positive twice? Yeah. See, Dara is strong in this also. Okay. How many of you have taken 2 vaccine shots? Wonderful, everyone. Thank you. We are compliant. Boosters? Gujarat is booster also. Great, thanks. You know why? Because we are talking about post-COVID emergence, and this is just to get into our brain. We are among those fortunate, 90%, whatever, 98%, but we are still here to discuss about that, the post-COVID emergence, pharma, significance, healthcare, vaccine, whatever it is. But we are among those fortunate. We are here and we are discussing that. So that's great. So few pointers, few indicators about what's going to happen post-COVID. So post-2021, 2020, 21, 2 years have gone. One indicator was in 2019, as a part of my job and of a tourist also, I went at least, I think, 8 or 10 times to out of India, Europe, US, whatever my conferences. And yesterday was the first time I touched international airport, after 2 years. So that's the post-COVID emergence. I flew, but I flew from T1. So T2 was yesterday first time somehow, Mumbai T2, which is a huge, big international airport. So what's going to happen, First is vaccine, right? Everyone knows vaccine, Serum Institute, COVID, Bharat Serum, whatever, Covaxin, Covishield, all those. But it's not just the COVID vaccine. COVID vaccine is for what, 2 years? Now booster dose is also, it's getting expired, so government is giving it free, all those things. But before COVID vaccine itself, India was the highest vaccine producing country. And it will boost now, it will triple, quadruplate, whatever. Why? Because there is a big pneumonia vaccine, big anti-flu vaccine, and pneumonia is a once a lifetime, but flu, and especially say our parents who are 80 plus, it is advised that every year you should take vaccine. They should take vaccines, those who are with a less immunity and those. So vaccine producing is going to be big, big, big. By the way, those who everyone heard about Serum Institute in these days, but the serum, the vaccine business started also from a, any cases, from the horse racing, right? Poonawalla is the biggest owner of the racing horses. So something positive happens out of anything and everything can happen. So out of COVID emergence also. And I estimate, I predict, perhaps, Jyotishi se Joshi ban gaya hu main. So I predict like how it happened, HIV, few years ago, 30 years ago, Cipla, Arbindo, Hetero, they started and then India dominated the world for anti-HIV, ARV drugs. IPC, Indian Pharmacopoeia, was the first to include those in any pharmacopoeia ahead of a BP and a USP also. Something similar will happen for all vaccine, I mean. Second is biotech. I don't know whether how, I'm sure most of you will be from a technical field, QC, QA, RA, production, whatever. But after certain span, you need to move to the management and more on the statistics. So if you go through IMS data, the top 10 pharma industries in the world and all those things, you don't find, or okay, you do find, out of 10, 8 are all biological, biotech industry globally now. All Amgens and those things, Pfizer, Sanofi, because they still figure there, because they have ventured into biotech also. Who is the highest vaccine seller in India? No, not Bharat Biotech, not Serum Institute, but still a GSK and Sanofi. because they ventured into this vaccine business, and that's how. So the another emergence will happen is more and more India has to focus on a biotech industry. Gone are the days of a conventional API synthesis, fermentation, everything is gone. Now the DNA, rDNA modification, so that will be another emerging area. I'm sure, Dara, you are aware, I don't know whether auxiliary industries are not much are IDMA members, but there are few, I know. 100 out of 1100. Oh, that's good. One of the most striking progress was done by industry in India during COVID. You know who are they? Not a vaccine manufacturer. Forget about Dolo. I don't want to speak here, but so many. The most business was done by syringe manufacturer. There is a company called Hindustan Syringe, right? I think somewhere in Rajasthan, Madhya Pradesh. They had a vision. They had, say, 1 line, 2 line of a syringe manufacturing. You know, you need a disposable syringe these days. They had a vision. They ordered for 8 more lines from 2 lines, because for what? We did syringe, the vaccination was what? How much? 100 crore, whatever, out of 130 crore, 2 doses, and India. For each vaccination, you need a disposable syringe, isn't it? So there will be emergence of all this auxiliary and allied industry, much bigger. So we need to look for that. All of you, QC, QA, RA, I still stuck to RA. Forget it. You need to change it to something else. And I'll give you example. What? Where you should go. 30 years ago, we started working with Novartis. I can name here. And my counterpart used to be first in a QA. He moved to, multinational gives this flexibility. Sometimes as a punishment also they are transferred. That's a different. But then on a proactively, he moved to sourcing. From sourcing to supply chain. And at a VP level, it's a change of job. One of the emerging area last 10 years is supply chain, isn't it? And what they call it as a growth through disruption. So supply chain was very much disrupted in this, right? You must have heard about China, containers, not getting ships, cargo, so much disruption. But when there is a disruption, there is a growth also. So I encourage all of you, forget your QA, QC analytical job and move to supply chain. Okay. Field change, but don't go to IT. And why I'll tell you, because I was speaking with these 2 young MBAs, and everyone, otherwise there is a model, in India. Do engineering, and what do? IT mein hai ladka. What they do in IT, I don't know. Everything is called IT. But this brings me back to my very favorite theorem. I must have shared it again. I share it again. Okay? So there is a difference between what I call DIKW. Data, information, knowledge, and wisdom. And because we talk about big data, data analytics, so many things these days here, if I tell you I throw you numbers, 97.5, 98, 96.3, 98. It is just a number. It's just a data. Does it tell you anything? Nothing. The moment I qualify it, I upgrade it, that it's a human body temperature of all these people sitting in this hall. It becomes information. Okay? Then I can process this information saying, okay, how many are 97, how many are above 98.5, how many are 96, whatever, So, and if I have a knowledge that if it is more than 98.5 degree Fahrenheit, then it is a fever, usko hall ke bahar nikalna chahiye, isn't it? That's the knowledge. So there is a difference between, and it's a misnomer, very conveniently we speak every time. After this, my presentation, speech, lecture, whatever you call, you will say, oh, Dr. Milin, very knowledgeable. Not necessary. I have information. And with a Google now, everybody has a information. Now, how to process that information, how to apply that information, you need a wisdom. जो God देता है, God gives you wisdom, and if you have that wise man is there, then you can convert data to information to knowledge, and we need wisdom for that. So please, just IT, nothing. Go to supply chain, okay? What is the another emergence? Darat spoke about work from home, staycation, that's a stay and vacation combination. So it's going to happen. My son, my son did masters in psychology, and he fools people with advertising and earns money out of it, So, but 2.5 years, he didn't go to office at all, not a single day, And like we used to pharma industry, so we are required. So we used to go to factory, we used to go to office. He didn't go at all, but they are still working. So these models are going to work. And again, I'm proud. Regulatory affairs was one of the department which we worked 100% of the time, but 100% from home. What you need is just a nice, good laptop, IT, working, IT-enabled solution, and we worked. And our dossier submission, compilation, everything was going on. And in fact, I can say here, I don't know if you follow again, JB Chemicals was kind of taken over by a private equity firm, KKR. And those who challenge that, can you work from home? So I give challenge to them, work from home? हमने तो घर बैठे बैठे company बेच दी during those 2 years. But in fact, I was the one 30 years ago, I had vehemently opposed to auto sampler to HPLC. Like, how many of you are working in QC or analytical? Okay, few. These days there is an auto sampler, and then it injects into HPLC. I had opposed it 30 years ago in a budget meeting. I'm saying, no, I can employ a PhD in analytical chemistry throughout 3 shifts in India. In India, I don't need auto sampler. Now forget are the days. Everyone uses auto sampler, isn't it? Why just an auto sampler? We have a form fill seal Romelag machine in Ankleshwar and Panoli. An engineer from Germany operates it and troubleshoots it, sitting in Germany. And why that? Even India, from Sriharikota, we operate our Chandrayaan, our mission to the Mars, isn't it? So now the office concept is gone, and gone will be days. Even analyst in a laboratory, 2022 you have to go, 2042 remind me, koi Milind Joshi bol ke gaya tha, you don't have to go to laboratory. You can work from home in a laboratory also. Drone delivery. How many of you have experienced a drone delivery of a pizza? Is going to happen. By 2047 vision, I'm a technical guy. So I don't know this 60 billion, 100 billion, whatever. But I know some indicators. We will be getting by 2047 drone delivery of a medicine to our doorstep, because in Thane, where I live, just outskirts of Mumbai, they are building a 72-storied building. 72-storied building, so that there is going to be a queue to the elevator, and it's going to take 20 minutes to reach to 72nd floor, isn't it? Drone will deliver like that. It's going to happen, And especially in case of emergency, essential medicine, drone will reach, it can come from this door and come here, isn't it? Designer drugs. Everybody talked about designer drugs. Very simple, I will give you example. All of us, we eat shev puri, pani puri, right? Every week, every month. Everyone has a different taste, isn't it? We say, bhaiya thoda tikha, bhaiya thoda meetha, all that. Drugs will not be exception to it. There will be designer drugs. And I'll tell you this from example of my grandmother. She used to take carbidopa, methyl-dopa, 50 years ago. And she used to cut the film-coated tablet by a scissor or by a knife, along with her symptoms. She would say, no, I need 2.5 today. I need a quarter tablet more. So every individual, depending upon body profile, weight, needs a different drug, different design. Why? As a painkiller, my wife insists on ibuprofen, and I hate ibuprofen. I will not take ibuprofen. So these are designed, it's what? It's all NSAID, simple, you need either diclofenac or ibuprofen, whatever, isn't it? But it's a designer drug. It satisfies you. And almost 90% drugs are 90% psychosomatic, isn't it? So there will be emergence of a big designer drugs, and where you can, kind of ask for, bhaiya thoda mithai dena pani puri. There will be new dosage form, last 5 minutes. How many of you have tested those thin film as a mouth freshener? Like, you get it. So there are now drugs of a thin film. They come, it's a easily, immediately absorbable, sublingual absorption. So absorption is good. There are gums, there are nicotine chewing gums. Of course, that people, the company who manufactures nicotine chewing gum or JB produces nicotine lozenges, we want people to get de-addicted out of cigarette smoking and get addicted to our lozenges. That's a different, but there will be, the new dosage emerge. Now, I've been outspoken right from throughout my life, you know that. Few new emerging area. There will be combination, Few years ago, there used to be Alliance Sarkar everywhere. Now, of course, they call it double engine. That's different. But, so there will be combination in the vogue. What combination? Drug and device, This is simple. We know inhaler, meter dose inhalers for asthma. But the inhaler, you have to combine with drug and device, the simple example. But, oh, by the way, all of you are the younger generation. Medical devices is going to be the most emerging area again. And we have a different rules and law and everything system for devices also. Why? And I feel so happy sometimes, and that's India's strength. We have, she still comes. We have a maid in my house. She's 60 plus. So her granddaughter, she did M.Pharm. She consulted me. She did M.Pharm in medical devices from Naipur, Chandigarh. So Naipur, Chandigarh runs M.Pharm in medical devices. And she was campus placed like this, through campus placement. Because it's a M.Pharm in medical devices, it's a very kind of new thing to India. What used to be 30 years ago for regulatory affairs. Abhi koi job nahi dete hain. But the new emergent, again, for my vision for 2047 is, there will be combination of drug and food. Today I used to always say, Dr. Koshia, it's a food and drug administration, and food comes first. So regulate food for more, you need to. And Gujarat FDA does that. And my aim was that कि drug वाले को थोड़ा छोड़ो बाजू में, food पे concentrate करो. That was different. But so now there will be combination of a food and drug. And again, this is not a fantasy. It will be truth. It will be reality. By 2047, you will get maybe analgesic fafda, anti-diabetic dhokla, khaman. And it's so nice, it's a patient compliant. I don't have to remember my pill, nothing. You go to your Hari Bhai Kandoi, Mandviwala, right? And ask for आधा kilo analgesic khaman dena. Wonderful, So I don't have to fight with my wife whether ibuprofen or diclofenac sodium. Just it will be there, a combination of a food and drug. And I'm sure Dr. Koshia and his predecessor, whosoever that time successor will be there, they will regulate this industry also. Koi Milind Dev Baba aisa jhoota nahi aayega. Everyone knows about already emerged nutraceutical, healthcare supplement. I went for a walk near Law College Garden. In Mumbai also is there various juices now. Pure kadwa khatte sab juices they and smoothies, green smoothie. But why? People are not mad, I always say by market. The truth of a marketing is you can't fool all the people all the time, isn't it? You can fool some people sometime, but not all the people all the time. So these smoothies, nutritional supplement, healthcare products, whatever you call, Ayurvedic, Allopathic, everything, they deliver. That's why it's an emerging area, and it will continue for next 30, 40 years unless they come out with something. Diagnostic, India has to play a long inning in this diagnostic. I have seen a cartoon few years ago, which has become into reality. In Japan, they say they come with a complete electronic commode, one with the adjustment. That's pretty common nowadays in Japan. So you can adjust your temperature, something like an aeroplane seat, everything. Now it has come into reality. The commode is fitted with all diagnostics. So just you get up in the morning, sit on the commode, and on your mobile there will be, your creatinine and everything all will be there through urine analysis. It's simply possible. You don't need a separate analyzer and everything, sampling technique. Those who are in analytical, you are aware. So it will be another emerging area, diagnostics. And all this, what we call is a hyphenated technique. Again, the era of alliance. In analytical, we have LC-MS-MS, GC-MS-MS, we call it hyphenated technique. This hyphen, this combination, drug device, food drug, food device, everything will be quite common, quite rampant, prevalent everywhere. I remember I have seen one interview of J.R.D. Tata, not Ratan Tata, earlier. He was asked, what is that you find that he said in his life, they all Parsis lived quite long, always, and good for us, of course, touch wood. So he said, in my lifetime, I have seen, sometime India goes, Dara, you heard that, right? So in his lifetime, J.R.D. said, he had seen India going down, 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 somehow. And he said, in QA terms, non-assignable cause. He said, I don't know why, what happens, I can't point a reason, but India takes up. And he had seen it at least 2-3 times almost. And we have overcome that, right? We had a severe recession, we had a political anarchy, it will keep on. In a pharma, price control, whatever we say, so recession, everything in a global. But India goes down, 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 and somehow it comes up, we become Atmanirbhar, we become, he talked about the vaccines. PPE kit is a great example, When lockdown started, India was an importer of a PPE kit. We never had a PPE kit good, sterile, all available. Within 4 months flat, India was a net exporter for a PPE kits. And we do it. That's the amazing capacity we have. We convert a threat into opportunity among the SWOT analysis. So I affectionately like all such J.R.D. Tata and these leaders. It makes me proud Indian. I am a proud Indian. It makes me more proud. I'm sure you will all join me in applauding all these leaders. And by 2047, we will be with all these emerging areas, what I talked about, and we will be on top of the global, not only in pharma, in the top economy, top country of the world in all aspects. And don't forget to invite me on the 2047 also. Okay? I'm a proud Indian, be proud Indian. Jai Hind.
Thank you so much, sir. We are delighted to have you this year with us, and we are again